Welcome back to the channel. I hope everyone is doing well. I hope you're having a fantastic day so far. In today's video, we're going to be focusing on different opportunities. I do have a position with Team Health as well as a pathology transcription role. I know it does sound very exciting and interesting, so we're going to be getting right into that. Please remember to always have your notification bell turned on. It is very important. That is how you are notified real time whenever I post new job leads. With that being said, let's dive right into these roles. The first one is this one right here, which is over provisions representative. It is with Team Health. Team Health is a healthcare organization, as you can see on here based on the name of the organization. Basically, they are more of a company that helps to grow different clinicians, different healthcare practitioners within the United States. And it says it right here, this is a remote job, right? And when you look at this position, expectation is you'll be responsible for processing credit balances, recouping adjustments with unidentified payment, hospital bills, clinic groups, really just helping to provide ethical check-ins to ensure that any type of issues that they may have that would potentially impact the interests of Team Health, this individual is going to help to investigate and get all the details surrounding those type of issues and concerns. It says it right here, carries out its or her duties by adhering to the highest standards of ethical and moral conduct in the best interest of Team Health. You are going to be responsible for processing credit balances, recoups, adjustments, and unidentified payments for clinic groups and hospitalists. All right, so now let's review the responsibilities more in depth. Because the expectation has to do around payments, so you will need to have some understanding of credit history, balance pay, transfer, also most importantly reimbursement payment methods, especially when it has to do with different unique organizations that do reimbursement, like CMS reimbursements, for example, might come into play. They also talk about you working consistently to ensure that any type of errors that are identified are corrected as quickly as possible, transferring payments from one system to another, voiding of checks is another important aspect of this position. Qualifications for this role, they are looking for you to have a minimum of high school diploma or equivalent and 1 year experience in medical billing, someone who is able to work in an organized fashion, someone who can work well under pressure, someone who can work in a fast-paced type of environment, the knowledge of Microsoft Excel, Outlook, Word, as well as Zoom are some of the qualifications they have listed here as well. So written and verbal communication skills, interpersonal skills, those by now are very common with almost every job I see. So I think it's very essential to continue to build your skill set around that. With this position, based on my research, the salary tend to be between $21 to $25 per hour is the range. So which puts you around the $40 to about $56,000 per year. So this position is open right now and accepting application. All right, so we're going to move on to this second position, which is the pathology transcriptionist, and it is with Northside Hospital. So pathology transcriptionist, and it is fully remote. So one of the beauties about healthcare, and I think I've mentioned this in my previous videos, is that you have all these nuanced type of jobs that anybody can really do without you having, in some cases, degrees or even having a tremendous number of experience. As long as you are able to do administrative and clerical work, you can actually land a solid job and be earning good money. So that is one of the reasons why I really love healthcare. So as you can see right now, this is a position that ordinarily you would not have even heard of, but they are out there. So this is a pathology transcriptionist position, and it is fully remote. With this position, the category is lab and medical technology, which makes sense because pathology has to do with labs. So this individual, what is your role going to be? Just as the title implies, you're going to be providing transcription for medical reports. You're going to be performing different administrative type of tasks around that. For example, if a pathologist who's a medical or a clinical person, they do their blood draw, or in some cases they've examined a corpse, whatever it is, they've determined that there's some form of diagnosis, some form of disease around the pathological work they've done, right? So they would put together some write-up of what that entails. This individual is going to take their write-up and basically help transcribe that into more easy to read, in some cases more layperson friendly. So that's what you're going to really be doing. If you're someone that is okay with transcription, I know working from home, transcription is one area that is always on the list. It's just nice to be able to reconcile that with healthcare for this particular role. So if you are someone that is comfortable doing that type of work, this is definitely for you, because that is exactly what you're going to be doing, working off the reports. So required 6 months of prior transcription or secretarial work experience, administrative clerical type of work, and they must have excellent knowledge of medical terminology, English grammar, composition, as well as spelling. Must have word processing experience and able to type 60 words per minute. This is really a data entry heavy position, because that's all you're going to be doing. One of the beauties about this too is the shifts. You see on here, it is evening shift, so you get to work evening hours. However, the organization is open from morning till about 8 p.m. However, you get to pick your evening shift, which is also beautiful. There are weekends requirements as well. You get to work weekends, right? Which I think can also be beneficial for some people. I know there are some feedback I've gotten in the past where people are doing their regular typical jobs and are looking for opportunities to maybe work extra second job over the weekend. This might be able to fit into that type of scenario for people, or others just want to change their position and get something that has more flexibility. This will also be it. So I was very excited to run into this position, so I hope you are as excited as me. So definitely go ahead and explore further, and then let me know if you have any questions at all surrounding this, or just any jobs that we will be talking about in this video. And with this position, the salary for this position is between $47,000 and $70,000 per year. That is the average per Glassdoor, which is not bad at all, right? So that's also an added plus, and it does come with benefits with the organization as well, so which is cool. All right, so we're gonna go now into Advent Health. Advent Health is a healthcare facility, and they're looking for people to fill two positions. Okay, the first position is this one titled Analyst Reimbursement. This is for managed care organization, which makes sense. Managed care, as I've talked about before, is just basically another word for health insurance companies. That's what it is. So they basically help to manage care on behalf of, let's say, for example, Medicare or Medicaid. So primarily Medicare in most cases. So they are looking for an analyst for reimbursement. What exactly are the perks? They do talk about all the benefits and perks you need for your family. They have benefits from day one. You have a career development. They also talk old person wellness resources and mental health resource and support. So that's basically what you will be getting. So the schedule is Monday through Friday, and it is fully remote. They have it specified right there. The salary range you see on here is between $21 and $30 per hour. What are the expectations for you as an individual taking this role on? You're going to be responsible for ensuring providers are loaded timely, accurate with managed care contracted payers, responsible for evaluating professional fee contractor adjustments for accuracy in accordance with payers contracts. So again, like I mentioned before, this is specifically for health insurance companies. So a lot of times when a health insurance company has a contract with Medicare, there are specific expectations that comes with managing Medicare recipients or members. So they have that contract in place. What they then do as a health insurance company is to find facilities that they can add to their network. That's when you see they tell you, oh, this person is in network for you, you can see us, versus we can't see you because we don't accept your insurance. That is when that happens. They contract with different facilities, and this is one of the facilities, for example, and the facility has an agreement with them to say, if I see this amount of clients, I get paid this, versus as long as I'm treating for this particular diagnosis, I get paid this. So some contracts are put in place between the facility as well as the health insurance company, where they already know what is expected in terms of payment. So that is basically what this role is. You would be handed a contract back with Advent Health, where they're telling you, for this particular health insurance company, this is how much they've agreed to pay us for ABCD, and when ABCD is billed for, we expect to get paid this amount. If we're not, we need to do a rebutter and say, no, this is not what we agreed on. We need you to meet the agreement. So that's basically what they're saying here. The expectation is that you are going to be reviewing contracts, and you're going to be making sure that whatever is written down is actually what's been applied at the end of the day. It does talk about credentialing, enrollment as well, which is important because the health insurance company can also come back and say that we have this agreement with you, but we want to make sure that the providers or the doctors, nurses, etc. in your facility, we want to make sure they have all the right licenses to be able to see the members we send your way. And that's where you come in, also making sure that licenses are accurate and also being tracked to make sure that it's still active. And that's where credentialing comes in. They're looking for you to have high school diploma or GED, 3 years of relevant experience in healthcare reimbursement, whether it's commercial or government payers. They are very interested, and they do have preferences here as well, where they're looking for you to have a bachelor's degree in healthcare or business administration. So that is this position. They have a second role open as well. This one is in denials management specialist. Just as the name implies, you are going to be managing all the denials that are being issued. So for example, again, still very much related to healthcare organization, insurance companies. So again, you would be fully responsible for anything that has been denied, services that have been denied by these health insurance companies, whether Advent Health has contract with them or not. And in some cases, for emergency care, for example, there is no expectation for anybody to go into a facility that accepts your insurance. It's just something that is not possible, because when people are having emergency needs, they are not thinking about whether or not this facility is going to accept my insurance. Instead, you're just worried about making sure that they are cared for and that they are safe at the end of the day. So those type of nuances comes into play. There are insurance companies that would deny those type of services. You as an individual would then help facilitate to make sure that payments are sent for those type of denials. And in some cases, there's a contract in place, but then there is still a denial, making sure that there is maybe wrong code processing or wrong code submission, helping to rectify all of that. This is fully remote as well. You see that here. And the salary is slightly higher, so it's between $21 and $32 per hour. Monday through Friday is the shift, so there is no weekend shift for this one. So with this, they are looking for high school diploma as well, 1 year experience in billing though. So this one is, in terms of experience, is a little bit more on the entry level side, because it's asking for you to just have 1 year of experience in billing, and it doesn't have to be in healthcare. So if you have done cash registry before, you've done cashier work before, that would count here as well. Advanced degree in any field of study is in the preferred qualifications. They do talk about someone with experience actually in healthcare claims processing as part of the preferred qualifications. But again, if you don't have any of these, it's all right as well, because they have certain expectations for individuals that will apply for this role. They're not expecting everybody to have everything. So I encourage you to still go ahead and submit your application. And when you feel like you don't have enough, always put a cover letter, because that explains and shows your passion for the role and just for being able to do a good job should you be offered the opportunity. So that is the last position for this video. I hope you find these leads helpful. Remember to give this video a thumbs up and most importantly, have your notification bell turned on so you're notified real time whenever I post these new job leads. Just remember to continue to share in any way you want to share. Remember, we are also on social media. Follow us on all platforms: TikTok, Instagram, everywhere. We are there. And yeah, thank you so much for watching these videos. Till next time, I will catch you guys in the next one. Wish you all the very best of luck. Take care, guys. Bye.